In the following short video, the fast-track joint replacement surgery will be illustrated. This project is organized as a strong matrix. In 2007, measures were initiated at St. Olav's Hospital to accommodate the increase in prosthesis surgery by adapting to the fast-track concept. Fast-track is a concept for the organization and implementation of surgical treatment when the objective is for the patient to achieve a normal or optimal functioning state as quickly as possible. The fast-track approach should focus on all relevant elements: preoperative information, stress reduction, pain management, mobilization, and nutrition. In order to adapt to this, St. Olav's Hospital went through major restructuring. An example of this was in 2009 when the orthopedic department was moved to the mobility center. One of the main challenges was that there were many different stakeholders in the project. The stakeholders included many professionals such as nurses, orthopedic surgeons and physicians, physiotherapists and technicians, cleaning assistants, and office service staff. Also, it was challenging to organize meetings since many employees and other stakeholders worked different shifts. Time pressures for the various project tasks, such as making new procedures, information literature for patients, detailed flowcharts for the operations, and PowerPoint presentation to the patient school at the hospital was also a challenge the hospital faced in this project. To ensure rapid communication, the project manager chose to practice close monitoring so that all team members had the opportunity to make quick changes and adjustments throughout the process. Close monitoring was also important for building good relations and interdisciplinary collaboration, since team members became involved and heard. The project team held regular weekly meetings between project initiation and implementation, but thereafter the frequency of the meetings was reduced to once per month. There were a number of incidents where decisions were made alone, which consequently affected the whole treatment plan. The project manager addressed these problems immediately when they were discovered and stressed the message that all decisions regarding the project were to be considered by the whole team. In several cases, the project manager relieved the team members by doing their tasks for them to ensure that the project tasks were completed at the right time. In order to discover general problems, regularly evaluations were held and measures were constructed quickly in order to solve them effectively. Completion of the project was at the end of 2012, and the project can be considered as a success as the following objectives has been met: good interdisciplinary collaboration and very satisfied patients, good reputation, and increased numbers of operations per week in the same number of operating theaters as used previously. The measurements of parameters show that the project was completed well on time and that all objectives were fulfilled. A major operational change was implemented according to plan, without any increase in waiting lists for surgery. In total, 134 patients were operated on in 2010. The target was 117. Compared with the target post-operative length of stay of less than 4 days and 90% traveling home directly after surgery, the corresponding results were 3 days and 90% by the end of March 2011. By the end of March 2011, patient satisfaction was 94%, which was slightly higher than the target of 90% patient satisfaction. There were some delays, and all outcome targets, results, activities, and initiatives were carried out according to both the plan and the schedule. For the employees, it was probably of great importance that they were immediately able to experience better flow and predictability in their working day. This was probably a contribution factor to the project's success. The high level of patient satisfaction increased the motivation among employees and was an important success factor.